So today we're going to be talking about chapter 36. This is about removable prosthodontics, and it's on page 834 of your Cengage textbook. And during today's lesson, we're going to be talking about the different removable prostheses and list the reasons for using them. We'll talk about considerations about the patient related to removable prosthetic treatment. We'll explain the dental assistant's role in removables. We'll describe the consultation appointment and the materials required for case presentation. We'll describe the advantages, disadvantages of the partial denture, its components, and the appointment schedule. We'll describe the complete denture, its considerations about the patient and the appointment schedule, as well as all the advantages and disadvantages with that type of denture. We'll also talk about the types and steps of the denture reline procedures, as well as the procedure for a denture repair. And we'll list the steps to polish a removable prosthetic device or appliance and explain the overdenture and the advantages and disadvantages related to it. So removable prosthodontics are artificial structures that replace teeth and tissues. Its purposes are to restore lost function, to stabilize the arch, and to improve aesthetics. Additional training is necessary to know how to deal with removables and their care, and also how to go about doing some of the lab work needed to make them. There are many options for patients when it comes to prosthodontics. The goal is to provide the patient something they have lost without additional pain and discomfort. There are certain patient considerations that need to be made for this type of appliance or for this type of treatment. First of all, good communication is necessary. You'll need to make sure that the patient understands the treatment length, everything about the treatment, and the cost, the advantages and disadvantages. The patient should be in good health. They should have a positive attitude and also be cooperative. Any one of those three things that are not doing so hot, they're not in good health, they don't have a positive attitude, or they're not cooperative, can really hinder the success of the treatment. Fluctuations in the patient weight may alter the fit of the prosthesis. So sometimes the patient may have to reline the unit to fit the different changes. Good oral hygiene is required, and the patient's mental and physical capabilities may hinder the placement and care of the piece if they're in bad health that way. The dental assistant should ensure that the process goes smoothly for both the dentist and the patient. Some of the things that they'll do are prepare the materials, they'll record measurements and details, educate and support the patient, and perform some laboratory procedures. After the dentist has gathered information from both the history and the current situation of the patient, he or she would also gather the patient's thoughts and take those into consideration along with the hard data and schedule a consultation appointment. The dental assistant usually prepares all the items such as the study models of the patient's mouth, the radiographs mounted on the view box, the patient's photographs, any visual aids to explain the types of appliances, and the proposed treatment plan so that the dentist can explain the diagnosis, the proposed plan, and the prognosis to the patient. Questions are answered at this appointment. After the patient has accepted a suitable financial plan, sometimes the office may contact the individual's insurance company and gather information prior to the consultation appointment. Some of the advantages of a removable partial denture are that they are easily repaired and adjustments are easily made. There are fewer appointments with these. They are easy to clean. They can support the remaining teeth, and they are less expensive than a fixed model. Removable partial dentures are designed to restore missing teeth and preserve the remaining hard and soft tissues of the arches. So this is a picture of what a removable partial denture looks like. For this to work, we should consider the adequate root structure of the remaining teeth to make sure that the clasps that these rest seats are basically resting on, that these teeth are in good health. So if any one of these teeth are in bad health, or there's not enough root structure or not enough bone holding those in, um, that would really hinder the success of the treatment. So just going over some of the different parts of the removable denture. A here is pointing to the denture base. So that is that pink acrylic color. Part B is pointing to the denture teeth, or the missing teeth. Part C are the connectors. It's also known as this lingual bar. It's connecting these two, I guess, sides of the partial. And then part D are the occlusal rests, also known as rest seats. So the components of the removable partial denture include the metal framework, which is this piece here. It's usually, this metal framework is usually embedded in acrylic. The rests here, also known as rest seats or occlusal rests. The connectors, which is this lingual bar that we see here. The retainer, which we don't see in this picture. The denture base, which was part A in the previous picture, and the artificial teeth, which was part B in the previous picture. Partial dentures are designed for individual patients without set patterns. So after the bite impressions have been taken, the piece is sent to a dental laboratory with a prescription form. The lab constructs it as specified and then sends it back to the office for a try-in adjustments phase. The appointment schedule includes an examination appointment, a consultation appointment, an appointment where final impressions are taken, another appointment where there is try-in adjustments, the final appointment, which is delivery, and then adjustments are made as needed, basically on an as needed basis. So even with the partial dentures procedure, there's quite a bit of work and quite a bit of different appointments that need to be made in order for the partial to fit correctly. So what are some factors for the dentist to consider in choosing a patient as a candidate for a partial denture? So we talked about this a little bit before, and the answer is uh, there should be teeth to which the partial can be stabilized. So no teeth with abnormal root structure or bone loss. There should be motivation and adjustments and ability to maintain good oral hygiene. These are just some of the considerations that were mentioned before. So with complete denture, this is also known as a full denture. And when all natural teeth are lost, there is no reason to keep remaining teeth, a denture is fabricated to replace and restore the entire set. If there is extensive bone loss, there may be a lack of support for remaining teeth in the arch. And if a patient has no desire to maintain any remaining teeth, it may be time for dentures, especially if he or she has decay and disease extensively. The patient may not be able to afford implants or any other treatment options. So here is what dentures look like. Here we see a picture of an upper denture, and this is a lower denture, and it's pointing to the denture teeth here, and this is pointing to the acrylic base. And the base is made of different pigments and colors to resemble the normal gingiva, as well as fibers for a more natural appearance. Teeth are made from either porcelain or acrylic resin. Porcelain tends to have a clicking sound when eating or talking, but it's more resistant to stain and breakage. They can be stronger, but they're also heavier. Acrylic or plastic has the advantages of greater resistance to breakage, and they also are quieter and bond more effectively. The anterior set includes 6 teeth, and the posterior set includes 8 teeth. So a patient requiring a complete denture will need to follow a series of appointments. The first is the oral examination and the taking of the first impressions as well as the radiographs. The next appointment is a consultation in which the treatment plan is explained and any questions are answered. Oral surgery will be performed if there is a need to remove teeth or contour the alveolar bone. Another appointment is for the final impressions, and these are taken after healing from the surgery is complete. Another appointment is a jaw relationship, and that's when the jaws, the two jaws of the upper and the lower jaws are determined. The dentures are created in the laboratory and then delivered to the patient. The patient will go in for follow-up and then we'll make additional appointments for adjustments as necessary. So during the consultation and oral surgery appointments, all information and options are given to the patient during consultations, as well as benefits and disadvantages. Oral surgery and prosthesis appointments are made according to the healing time needed. Another appointment is taken for the final impressions. So basically, after extractions have healed, custom trays are made from the study models to take impressions for the manufacture of the base plates and the bite rims, which are usually used for the jaw relationship appointment. During the jaw relationship appointment, there is a device that's called a face bow, which records the relationship of the maxillary dentition to the the TMJ, excuse me, or the temporal mandibular joint. The face bow transfer takes specific measurements needed to transfer to the articulator. These measurements are taken by the dentist. The specific measurements taken by the face bow include the vertical dimension, which is the vertical measurement of the face between the 2 points above and below the mouth. The centric relation is the position of the mandible when the condyles are positioned posterior superiorly or unstrained position in a glenoid fossa. The intercuspation is a measurement that takes from cusp to fossa relationship of upper and lower posterior teeth against each other. The centric occlusion relationship of opposing occlusal surfaces that provide maximum planned contact or intercuspation, or when the cusps of basically of the upper and lower teeth come together. There is retrusion, there is protrusion, and there's lateral excursion, which is basically the movement of the mandible from centric occlusion to lateral, or basically from the center or from side to side. So name the measurements that are taken with the face bow. So these are the ones that I just explained. We have the vertical dimension, the centric relationship, intercuspation, centric occlusion, retrusion, protrusion, and lateral excursion. So sometimes the denture will need to be relined and or repaired, and during a chairside relining appointment, or during a chairside relining, the chairside relining procedure is beneficial because it does save the patient time. The patient won't have to be without dentures, so it can be done chairside in the dental office, and it doesn't require that the denture go to an offsite lab. But sometimes these type of relines are temporary solutions. Sometimes the tissues are irritated and inflamed due to an ill-fitting denture. These tissues must be healed before a denture reline is completed. This process is called tissue conditioning. This is basically a soft lining material which is placed in the denture to relieve the pressure and allow the tissues to heal. The healing usually takes several weeks to occur, and once that happens, the denture can be relined again to a more permanent relining. Repairs can sometimes happen if the patient cracks or chips or breaks their denture in some way. When this happens, we always want to disinfect their dentures before sending them out. Some repairs will need lab work, which usually means impressions may need to be made. A removable prosthesis can be polished on a dental lathe using rag wheels, pumice, slurry, and various other polishing agents. Be careful not to overheat the dentures, and you want to use enough water in your slurry mixture so that you don't overheat and score the dentures. Plastic teeth should be protected, and after polishing, you want to wash them in soap and water, disinfect them, and then store them in water until they're delivered. Okay, so this is an example of an overdenture. This is when we have implants that are placed in the patient's jaw. Not a lot of them. Sometimes there's two, sometimes there's four. In rare cases, there's six. And these implants will become anchors that the dentures will snap into. These are nice because they provide the patient with retention and stability so that they can go about talking and eating without the fear of their dentures falling out. Some of the disadvantages of the overdenture are that they're increased in cost and time. We're talking $10,000 to $20,000 an arch for some of these dentures, which will include the whole surgery for placing the implants, and then time, because we need to make sure that these implants heal before we can load them up with a denture. So that can sometimes mean 4 to 6 months for some patients. The patient must also have good oral hygiene because we're basically replacing their permanent teeth again. And even though fake teeth can't get cavities, they can collect bacteria, which can cause issues inside of their mouth. The patient must also be diligent and motivated for success. All right, so this is everything that I have for chapter 36. Please let me know if you have any questions. Thanks for listening.